Welcome to Doctors on Call. I'm Jenna Miller. Life after cancer is a reality for a growing number of Americans who are now described as cancer survivors rather than cancer victims. The cancer death rate has declined over the past 25 years with advances in early detection and treatment that have made cancer a curable disease for some and a chronic disease for others. But cancer is still the second leading cause of death in the United States after heart disease. Cancer prevention and screening, that's our topic today on Doctors on Call with our guest, Dr. Peeran Sandhu from the Tammy Walker Cancer Center in Salina.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Peeran Sandhu is board certified in internal medicine and medical oncology. He attended the Medical University of Lublin in Lublin, Poland, and completed his residency at the University of Oklahoma's College of Medicine. Dr. Sandhu completed his fellowship in hematology and oncology at the University of Oklahoma's College of Medicine. He is on staff at the Tammy Walker Cancer Center and Salina Regional Health Center. Our phone lines are open at 1-800-337-4788 toll-free if you have any questions regarding cancer prevention and screening on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician. Thanks so much for joining us tonight, Dr. Sandhu. Let's go ahead and start with some questions of our own while we wait for those calls to come in. First of all, let's talk about what the role of a medical oncologist is.
A medical oncologist, usually most patients that see their primary care doctors and they find something suspicious and they get a biopsy. And if they get diagnosed with cancer, let's say breast cancer or colon cancer or lymphoma, then the referral is made to a medical oncologist. And medical oncologist's job is to treat that disease, make a determination actually if to treat the disease with surgery only, or if to treat the disease with surgery first, or if the patient may need radiation, and or if the disease will be better treated with all three modalities, surgery, radiation, and chemotherapy, or if patient may just only need chemotherapy. So, and once the cancer is treated, then the medical oncologist usually follows the patient at least for 5 years, depending on different cancers, to monitor time to time to make sure the cancer remains in remission and doesn't come back.
You hear a lot about the 5 years. Can you explain to me what it is about that magic 5?
Sure. So the cancer recurrence, the highest rate is in the first 2 years. Then the cancer recurrence rate drops dramatically. And because we know that that happens in almost all the cancers, so the number of times we see the patient then becomes less frequent. Instead of seeing the patient every 3 months, 3 to 4 months, we see them once every 6 months for the next 3 years. So then after 5 years, the cancer recurrence risk is not zero, but pretty close to zero. A lot of patients can still have, some patients can still have their cancer come back, unfortunately. But usually we're not that concerned that we need continuous follow-up with the cancer doctor. A lot of the time we can just refer them back to their primary care doctor who can follow up and do the normal screening that they usually would otherwise.
Okay. All right. Very good information. We're going to go to the phone lines now. We've got Debbie on the line from Goodland. Hi, Debbie. Go ahead with your question for Dr. Sandhu tonight.
Hi. Thank you for taking the call. I have a question about cancer prevention. in the realm of
I'm sorry, you're going to...
take.
Debbie, can you start over with your question? We're having troubles hearing you right now.
Okay. I had a question about cancer prevention in regards
Yeah.
to your food intake. I was told that charred foods...
I'm sorry, Debbie. We must be having a few technical difficulties. We are not hearing your call. I don't know if your television is up. If you turn that down, we might be able to hear you a little better.
Okay, I just shut it off. I had a question about food intake and cancer prevention. I was told that the charred foods...
Okay. Debbie, I'm sorry. You might have to call back because we are not, maybe try a different phone because we are having a lot of difficulty understanding you. So how about if you hang up now and try to call us back and we'll try to get you back on here in a minute. And in the meantime, we're going to go to another phone call. I think they said it's Trevor on the line that's ready to ask a question. Go ahead with your question, Trevor.
Maybe I can just start with them.
Okay, sure. Is Trevor on the line? No. Okay, Trevor hung up, so we'll hope to get Debbie back. I think I hear Debbie's calling right now, so hopefully we'll get her back. In the meantime, let's talk about why it's important for a cancer doctor to be board certified.
So board certified, it standardizes the amount of information a cancer doctor must know to be competent in order for him or her to practice. That's why it's important. So it's a standard, just as if let's say we took a math class, and there would be a final exam to make sure that we know the stuff that we studied. Same thing in board certification. They just check that to make sure that we know the signs of cancer, how to follow cancers, the possible treatments of different types of cancer.
Okay, so what are some of the risks that men and women can do, or some of the things that men and women can do to decrease their risk of cancer?
So most of the risk reduction comes down to two things. One is patient's own health, general health. The other is cancer screening. Over the past 30 years, I think since 1990, the obesity rate in US has gone up by at least 35%. And the cancer rates have also increased over time, approximately the same number. And so the obesity has increased the cancer risks of colon cancer, prostate cancer, kidney cancer, breast cancer, endometrial cancer, and ovarian cancer. So I would say that the best things we can do is to make sure we are normal weight, which is much easier said than done in the current environment. Because there's so many easy and delicious foods available, and kale doesn't taste that good. So I think that would be a start. If any of us who are overweight, if we try to bring our BMI less than 25, that is a healthy BMI. Anything over 25, then the risk starts to increase. Because as we get heavier, we actually have more insulin in our system. And insulin is thought to be the driver, even though people become diabetic because they have insulin resistance. But because of a lot of insulin, it actually drives the cancer cells. Cancer cell growth, and it helps cancer cells spread. So I would say the exercise and healthy eating, which would mean more fruits and vegetables, nuts, beans, and less meat. Smoking cessation is a really important part, or any kind of tobacco use. Some patients actually chew tobacco, they don't smoke. And about half an hour of exercise a day can help reduce the cancer risk. And then almost all the primary cares, they know which patient needs what type of screening. So as long as patients are following up with their primary care, they would get timely screening. And if they have any abnormal symptoms, they should not be afraid and think that, oh, I don't want to find out. They should actually, it's much better to find out early. And the chance of cure and the chance that the patient will live longer are much higher than if we are just scared and we don't go to the doctor just out of fear.
Absolutely.
So that's what I would recommend.
Okay, excellent. We're going to go to the phone lines. We've got Faith from Eureka on the line waiting to ask a question. Hi, Faith. Go ahead with your question tonight for Dr. Sandhu. Faith, are you there? Hello, Faith. Are you ready to ask a question? Maybe. We must have lost Faith as well. Okay. Well, I believe we have Debbie back on the line. So if Debbie is ready to ask her question, we are ready for her. Hopefully we can get this call to come through. Hi, Debbie. Are you on the line?
Hello? Hello?
Yes. Hello, Debbie. Go ahead with your question.
Okay. I have a friend who has cancer, and when they were first diagnosed, their marker was about 600. Can you hear me?
Barely.
Did any of you hear the question?
Can you hear me?
Okay. Okay, try again. Try this. We can barely hear you, Debbie, so go ahead. We'll give it a try.
Can you hear me now?
Yes, we can.
Okay. I have a friend who had cancer, and there is something called marker that they determine by a blood count, and like it started out 600, now down to 98. What is the meaning of this marker, this cancer, and from the blood?
Do you know what type of cancer? Doctor's wondering what type of cancer.
Well, I think stomach.
Okay. So there are some proteins in the blood that cancer cells secrete, and we monitor them. Not all cancers secrete that. Usually, cancers of the stomach or the CEA is elevated. So we check for that protein when somebody is diagnosed. And then we follow it as we give them chemotherapy. It's a faster way of finding out if the chemo is working. Because CAT scan usually we wait at least 3 to 4 cycles of chemotherapy. But tumor markers, sometimes we can check after 2 cycles to see if they're going down. If they're going down, that means the tumor is dying, and there's less and less number of cancer cells left to secrete that protein. And pancreatic cancer has a different marker. It's called CA99. And prostate cancer has PSA, as most of us know. So those are the most common ones that usually in GI cancers and in cancers in men that we follow. There are some tumor markers in breast cancer that can be followed, but they're not always elevated. So usually when somebody is diagnosed, we check it initially to see if they're elevated. If they're elevated, we can then follow them time to time, even though it's not really recommended to use those tumor markers as follow-ups. So that was Debbie.
That was Debbie, yes.
So Debbie, that's what I think it is. It's probably CEA that's being followed. And if it is down to 90, that means she has a pretty good response to whatever treatment she's receiving.
Excellent. Okay, back to the phone lines we go. We've got Cathy on the line now from Salina. Hi, Cathy. Go ahead with your question for our doctor tonight.
Okay, thank you. Doctor, my brother has leukemia, and he's had it for about a year and a half. And is there a cure for that, or does he just have to continue with chemotherapy?
Can you go ahead and repeat your question, Cathy?
My brother has leukemia, and he's on chemotherapy right now. And is there a cure for leukemia?
What kind of leukemia, doctor's wondering?
Well, it's in his blood.
Is it, Cathy, is it chronic leukemia?
Well, they said that he'll have to stay on this medicine for 5 years, the chemotherapy medicine, and there might possibly be a remission. They don't know, though.
Okay. Yeah, it's difficult for me to say without knowing the specifics, but usually patients, how old is your husband?
No, it's my brother, and he is 53.
53. Okay. So usually at that age, they can get either chronic myelogenous leukemia or chronic lymphocytic leukemia. And both of those are slow-growing type of malignancies, and they can be controlled or put into remission. CML responds really well to the medications we've been using at least since 2005. It's called Gleevec, and there are second and third generations of the same medication that can be used. But if he has CLL, then I think then I'm not sure which medication he would be on. If it is by mouth, there are several agents that come by mouth. So it can be put into remission for a long period of time, but a cure is not. There's nothing that we have on the market that can cure it.
Okay, we have Debbie back on the line from Goodland. Hi, Debbie. Did you have more to ask the doctor tonight?
Hi. I didn't get to ask my question. I was the first caller. But I had a question about, I understand about good nutrition being good for your body and all of that, but are there actually things that can cause cancer that you can eat? Like I'd heard the charred or burnt edges of food when you're grilling or cooking things in tin foil can be actually cancer-causing. Is this true? And what are your opinions about some of the things that we should stay away from?
So I think there is evidence of charcoal when we cook food or barbecue that has some risk of causing stomach cancer. But as far as the pans are concerned, there aren't any definitive studies that I can tell you which detail the risk of cancer in terms of the type of pan you cook in. But the foods that can increase the risk of cancer, it's usually red meat is associated with increased risk of colon cancer, and animal fat is associated with increased risk of pancreatic cancer. So high fiber diet is usually considered to be protective. I think those are the major foods. Oh, and yeah, actually there's a big category of foods. So if we have processed foods that are processed in salt, they increase the risk of cancer. Bacon and can also do the same. It increases the risk of cancer. So those are some of the things to eat in limited quantity and not very frequently.
Okay, excellent. Okay, we're going to take another call. We've got Trevor now on the line. Hopefully we can get Trevor to ask his question this time. Go ahead, Trevor.
You there?
We are. Go ahead.
All right. Hey, doctor, it's Trevor.
Hey, Trevor.
You know, I don't have a question. It was just yesterday when we talked. I just consider you such a good friend that you said if anything was drastic, because every time I get a CAT scan, you know, I just freak out until I get the results. You said you'd call me personally, and that really meant a lot to me. That's all I really had to say to you, but...
Trevor, I didn't get it. I didn't hear him. Did you?
He was just saying that you had told him you would call him, and he was very appreciative of that. So
Okay.
he's singing your praises, I suppose.
Okay. I got concerned. I thought maybe I forgot to call.
Oh, no, he was thanking you for the call.
Thank you, Trevor. That's very nice of you. Thank you.
Okay, we've got Anna on the line now from Topeka. Go ahead, Anna.
Hi, I had a friend that was recently diagnosed with cancer, and I was just wondering if you have any suggestions for the best way to support her as she goes through this journey.
Anna, would you re-ask your question? We're still having some difficulties with our audio. Can you try your question again?
Sure. I have a friend who was recently diagnosed with cancer, and I just wondered if there was any suggestions of ways to support her the best way that I can as she goes through this.
As a friend, you're asking as a friend what you can do for your...
Yes,
support?
that's what I'm asking.
Okay. I think the most important thing is if you have time to just be there. Just be there. If you can make it, go to her doctor appointment with her. And if she's going to get chemotherapy, she'll feel really supported if somebody's with her. Because it's quite scary and unnerving thing to go through. And I think that's the most important thing for you to is just be a friend.
Excellent. Great question. Let's talk about what a person might be having going on with their body, or what might be going on, and that would be a red flag for potentially being cancer.
So for different cancers, the signs and symptoms are different. Let's say if we just start from the head, if somebody's having headaches, which they didn't have before, and it's something unusual, something just started, and if it's once every now and then, nothing to be concerned about. But if they're more frequent, getting worse, then that person should seek help. If somebody's having difficulty, let's say eating, the food is getting stuck in their throat, or so that would be a concern. So they should have it themselves checked out. If they feel a lump on their neck or under their armpits, that should be a concern. For ladies, it's important for them to actually do self-exam, make themselves familiar with their breast, so that if there are any changes ever, then they should actually see their primary care doctor and at least have a mammogram. In postmenopausal ladies, if there's nipple discharge, actually even premenopausal, if there's untimely, if somebody isn't lactating, and there's nipple discharge, or there's retraction or dimple forming in the skin of the breast, that's usually a sign. For with upper GI cancers, patients usually start losing weight, or they may eat and they say, we just have really bad heartburn. And constipation can be another sign, or change in bowel movements where patients are having bowel movements, but they're very small in caliber, and they have to take a lot of stool softeners and laxatives in order to go. So that would be another sign. So different cancers present with different signs. For men, if they're having blood in the urine, and same for ladies, if they're having blood in the urine, that would be a concern. Anybody who's postmenopausal, and if they're having vaginal bleeding, that is a red flag. And a lot of people are now with light skin that are out in the sun. If they see any suspicious mole which has changed color or looks different now, that should be checked out.
Okay. All right. Thank you so much for being our guest tonight.
My pleasure.
That was Dr. Peeran Sandhu from the Tammy Walker Cancer Center in Salina. On our next Doctors on Call, we'll learn about physician's assistants and nurse practitioners in healthcare. You can email us questions at doctors@shptv.org. Thanks for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital. Experts, neighbors, friends.